need them, who should have them in place, and the benefit that they serve. And then what to bring with you to office visits, when you need to call the doctor versus when you need to go to the emergency room, and I'm sorry, it looks like that got cut off. And then what to do in the event of an emergency, and then we'll just summarize kind of why being organized really matters when it relates to your health care. So keeping lists. There are a few lists that you should have on hand as it does relate to your health care that are important, not only for us as your health care providers, but also for your family and friends or other people that are helping to take care of you. Some of those lists include a list of the symptoms or any questions that you might have in between your doctor's visits, a list of your medications, a list of past medical and surgical history, a list of other healthcare providers, as well as equipment vendors. All of these are important things to have. And how you keep this list really doesn't matter. There's no right or wrong way to do it. You want to do it in a way that's going to be easy and accessible for you to get to and also to update and manage. So, good old-fashioned pen and paper is fine. We have patients that come in and they have, day planners that have calendars and note sections and contacts. That's fine. I've seen patients come in with just spiral notebooks or binders that have the information in it. That's fine. My personal lifeline is my smartphone, and the phones have good resources in them. They have a note section where you can keep some of these lists. You have your contacts in there, you have a calendar, and pretty much you always have your phone with you. So it takes a little bit of work on the front end to get everything documented and loaded, but once you have it, you should be good to go. So noting your symptoms and questions, and again, I apologize if these pictures are now being covering up the words, but it's a good idea, if you come to our ALS clinic or most ALS clinics you go to on a quarterly basis or every 3 months. So in between appointments, things are going to come up. You're going to have questions, you're going to have symptoms maybe that don't necessarily warrant a phone call to the office, but you want to make sure that you bring it up at your next visit. So writing these symptoms down as they come up is a good way to make sure that you don't forget when you actually get to your office visit. If you are having particular symptoms, it's good to note if you have any particular pattern in your symptoms. So say you're waking up in the middle of the night with muscle spasms. If this is a pattern that's occurring, write that down. When you come in for your visit, that's going to help us as your healthcare providers know really what's going on and figure out how to best treat those symptoms. And also, most people have, family and loved ones across the country, and everybody has concerns, everybody has questions, they want to be involved in your care, but they can't necessarily come with you to your doctor's visit. So it's a good idea to maybe have a phone call or do a Skype before you have a clinic visit and write down any of those particular questions that those family members have. If you have all this information, when you come to clinic, it's going to make the most of your time. You're going to make sure that you get everything addressed while you're there. You're going to have a place to document the answers, and you're going to be able to go home and review that information. And then medication list. So this is very important. This is something that is definitely near and dear to Dr. Brooks's heart. He has been known to come and fuss at his nurses if we miss something on the med list. So I wanted to go over kind of what we need to see on the medication list when you come in and why it's so important. So the basics of what we need to know the name of the medication, the dose or the strength of it, and how often you're taking it. So if you're on Riluzole, for example, it's 50 milligrams. You do one pill 2 times a day. It's also good for you to know why you're taking the medication, of course, and who prescribes it. This format, not this particular one, but how it's supposed to look, this is the easiest one for us to read and understand when you come in. I cannot tell you how many patients we have that have come in for appointments. We've gone to review meds. They don't have their medication list. They think that they know them all. And they get there and they say, oh, my primary care, they just put me on this pill for my blood pressure. It's a yellow pill. It's like this big. You know what it is? And we're like, no, we have no idea what it is. So, make sure that you write it down and have that basic information. I've also seen lists that look more like this. And this is some patients and families will break down scheduled meds. So they'll have morning meds, afternoon meds, evening meds. I think that this format is a little easier if you're self-administering meds and you kind of need to keep track of what to take and when to take it, or if you have multiple caregivers that are coming in, it kind of gives a little checklist for them to say, okay, in the morning I'm supposed to have 3 pills. These are the 3 pills that I have. We can certainly read this list. You can have both lists if it's easier to do something like this and keep it with your actual medications, that's fine. The most important thing is that you just have it down. And one thing that I'll also note, I think a lot of people overlook the fact that vitamins and over-the-counter medications are still considered a medicine, and we need to know about them. Some patients take supplements that are kind of weird, and they don't know the dose of them. So make sure if you are taking a supplement or a vitamin that you note the strength of that vitamin, and you're able to tell us when you come in. And then additionally, having documentation of your past medical and surgical history is important. We need to know about you as a whole person. We know that you have ALS, but there are other things that you could have going on that could explain some of your symptoms or could impact your ALS. So knowing your medical history, knowing what surgeries or procedures you've had done, and then having as much details about those particular conditions or surgeries is very important. Knowing when you had it, where you had it. That way, if we have to try to track down those records, we kind of know where to go. This is something that you probably won't even have to update that often, hopefully. And it's something that you may not have to provide at every visit. Normally, if you're going for your initial appointment, the doctor will want to know this. And certainly, if you find yourself in an emergent situation, having a list like this handy is important. And then also, we need to know the contact information for your other healthcare providers. We need to know the name, what purpose they serve with you, the address, the phone number, the fax number. We need to know this information because if you come in for an appointment with us and say you just had blood work done at your primary care physician the week before, if we have this information readily available, we can call them or fax them or request instantly. We can get the information in a more timely manner. And in addition, if to provide you with continuity of care, we want to be able to share our clinic notes with these other providers as well so that we're all kind of on the same page. And this is the very most basic information that we would need in order to be able to do that. And that goes hand in hand with your equipment providers. Most patients have several different providers for different equipment. So you might have one provider that's giving you your wheelchair and your hospital bed, and then you have another that's doing your respiratory equipment, another for your tube feeding supplies. Having all of this information is really helpful for you as the patient and for your caregivers if you need to reorder supplies or you're having a problem, you know who to call. It's also good for us if we need to send orders over. This is the information that we're going to need. And so now I'll talk just a little bit about some of the very important forms that we definitely encourage and discuss at our clinic. Advance directives, living will, and power of attorney form. So an advance directive is a legal document that's going to let you as the individual spell out your wishes about end-of-life care, what you want to happen ahead of time. They tell your family members, your loved ones, your healthcare professionals what you want to happen. It takes the guesswork out of it. The living will gives a little bit more details about what specific interventions you would or would not want. So, for example, if you would want life support, if you would want to go on a ventilator, if you would want cardiac or pulmonary resuscitation if you were to stop breathing or your heart was to stop beating, if you want a feeding tube, the living will really spells out all of those specific things. And then separate from the living will is a do not resuscitate order or a DNR. I just put that on there because if in your living will you decide that you don't want any life support, you don't want any type of resuscitation, it's a good idea to get a DNR completed. The DNR is also known as a gold rod because it's on a yellow sheet of paper. You have to have this done when you're at a doctor's appointment. So your doctor has to fill it out and sign it, and then they hand it over And this form is only valid if you have a hard copy. So if you do get a DNR, you need to keep that form pretty much with you at all times. Keep it, if you're at home, keep it taped above your bed or keep it on your refrigerator somewhere really easy, that if there was an emergency and EMS had to be called, you have it. If you can't produce that document, a healthcare provider has to start life support on you, has to try to resuscitate you unless you have that there. And then the last thing is appointing a power of attorney. So a power of attorney is a document that gives proxy to somebody else to help make decisions for you in the event that you're not able to. A healthcare power of attorney is going to be the person who can make those healthcare decisions for you. This would be if you become unconscious or unable to communicate, this is the person that's going to speak up on your behalf and say, this is what my loved one wants. It's important for you to have the advance directive and the living will in place, as well as the power of attorney, because you don't want to put that burden on that person. You don't want to appoint a power of attorney, but then not have spelled out your wishes. So all of these things are different, but they kind of go hand in hand, and they're equally as important. So who needs to have these forms? It sounds like a lot of doom and gloom, but really we all need to have them. We know that life is completely unpredictable. Anything can happen at any time to any one of us. But if you have a chronic or progressive illness like ALS, it's really important because we know that certain things are going to be inevitable. You want to make these decisions in advance when you have time to really process what you want and think about it. You don't want to do it when you're under duress or where you're in a critical situation. And know that your forms can really be changed at any time. So you might fill out a living will, in advance that says you don't want a feeding tube, but then down the road you might realize that you might get some more education, you might realize that you want it, you can change your living will. As long as you're conscious and able to make those decisions, you can change them. And the important thing is to just keep these forms in a safe and easy to access location. Make sure that your power of attorney knows who they are and knows what you want. And then what do you need to bring to be prepared to come in to your office visits? So of course you want to bring your list. You've spent all this time putting these beautiful lists together. You're prepared, you have your medication list, it's accurate, it's up to date. You have a list of your healthcare providers. You have all your questions and concerns written down. Bring that in with you. Again, this is going to help us maximize your visit. We're going to be able to get you worked in efficiently and be able to give you concise answers. Make sure that your clinic has a copy of your advance directives, your living will, your power of attorney forms. Again, we need to know what you want so that we can better guide your care. And then make sure you bring in any equipment that you're going to need to use. We have had some patients that will come to clinic and it's an all-day clinic and they don't bring their formula for their tube feeds that they need to do, or they don't bring their suction and they're using it every hour at home. So make sure to be prepared that you bring everything that you currently use at home. And that's really important for any time you're going to travel. Take what you need with you. And then make sure that you're bringing your respiratory equipment. If you're on a BiPAP or a Trilogy, the respiratory therapist at the clinic appointments will do downloads on those machines. If they need to make changes, they'll do that while you're there. So definitely any equipment that needs an adjustment, you want to bring that in so you can get it taken care of that day. And then how do you know when to call the clinic in between appointments? So anytime that you feel like you're having a side effect or you're not tolerating a medication that we've prescribed for you, we don't want you to stop taking the medicine or do nothing. We want you to call us because we might need to change the dose. We might need to give you a different medicine altogether. So make sure that you call and let us know if you're having problems. Definitely call if you're having any changes in your symptoms that you think you may need a medication change or an intervention. Some triggers are if you're having more shortness of breath, if you're having weight loss or increased choking, or if you're having a lot of falls. These are important things that we need to know about so that we can go ahead and intervene. We don't want you to wait until you have to come back to get that taken care of. Additionally, if you have any questions about equipment or therapies that we've ordered, give us a call. We have a team of experts, as most clinics do, that can provide you with some good feedback and make sure that you understand and that you've got everything in place. And ultimately, when in doubt, we're here to help. We're a resource for you all. I actually really like easy questions, so no question is too simple. So just give us a call if you feel like you got something on your mind. And then kind of on the flip side for that, we definitely encourage patients to maintain a pretty close relationship with their primary care physician. You're going to have things come up that you don't want a neurologist necessarily trying to manage and navigate. So you want to call your primary care if you're having any side effects or questions about medications that they might be ordering. If you're having problems with other health conditions like your blood pressure or your diabetes, you want to call your primary care. And if you have any concerns that you might have common ailments like a cold or sinus infection or urinary tract infection, your primary care physician is going to be your best resource for those types of questions. And then, unfortunately, there are going to be certain situations where you really need to go to the emergency room to be evaluated. Some of those include if you all of a sudden become unexplainably short of breath, if you're using a BiPAP or a Trilogy, you go on that, that's not relieving it, it's not getting better, it's unusual. This can indicate that you have a blood clot that may have traveled to your lungs, which is definitely a medical emergency. You need to go directly to the emergency room and be evaluated. If you yourself or if someone notices that the patient is becoming confused or disoriented, they're just not making sense, they're not talking logically, they're not alert, that could be indicative of a very serious medical emergency such as a stroke or some type of infection. That definitely needs to be looked at and addressed. Certainly if you're having chest pain, you feel pressure on your chest, you have any pain radiating down your arm, those are signs of a heart attack, you would want to go to the emergency room. And then one thing that we hear a lot of reports about is patients falling at home. If you have a fall and you hit your head, you really need to go and get that evaluated. We've probably all heard stories about people that have hit their heads, thought it was nothing, felt okay, and then a couple days later ended up in the hospital in critical care because they had a slow bleed. So it's better to go get those looked at and kind of err on the side of caution anytime you do hit your head. And certainly if you fall and you sustain any type of apparent injury, if you're having pain in the area where you fell, if you think you've broken something, if you need stitches, you need to go on into the emergency room. And then the last thing that I note on here is if you have a fever that's not responding to over-the-counter medications like Tylenol or ibuprofen, especially if you're having fatigue and body aches and problems breathing, this could indicate that you might have a pneumonia or some type of infection going on that would need to be treated. Some of these cases maybe you could, call the office and find out what they think, but ultimately you probably need to be evaluated and have chest x-rays and possible interventions that can't be done timely in an outpatient setting. So this is why you would want to go to the emergency room. And definitely if anything happens that is abnormal, you're not sure about, you just don't feel right, and it's outside of normal office hours, so you can't call and ask a nurse and get some feedback, it's better to just go to the emergency room and be checked out than not. So in the event of an emergency, if you find yourself in an emergency situation, in one of those situations where you have to go to the hospital, don't panic. You're going to be prepared because you're going to have your list together. Take all of that information with you. An emergency, there's enough chaos. When you get to the hospital, people are going to be asking you a million questions. If you have all of that information handy, it takes the guesswork out of it. It's going to make for a lot smoother of a situation, so make sure you take your meds, you take your medical history, you take that contact information for your other healthcare providers. Another thing that's important is that you make sure you take any respiratory equipment that you're using, like if you're on a Trilogy or a BiPAP again. Hospitals might not have the same equipment that you use and definitely will not know what settings your equipment is on, so if you take your own machine, that allows for a lot smoother of a transition as well. Make sure you take all of your advanced directives, DNR, living will, power of attorney forms, so that, again, those healthcare providers can know your wishes. And when things have stabilized and you have a chance, notify your ALS center. That way, if we need to intervene, if there's something that we can do, we can be aware and we can so they can instantly see our notes and we can instantly see what they're doing. So it definitely helps communication, helps bridge that gap. They have access, instant access to your information, so that makes it a little easier. And then, why does all of this matter? Again, being organized, having some of this basic information set up and in place is going to set you up for the best possible outcome, whether it be a regular doctor's visit or whether it's an unplanned trip to the emergency room. Having accurate information is going to keep you safe. It's going to make the best use of your time. It's going to maximize your visits. And it's also a way to kind of keep your whole family involved if they, again, have certain questions or things that they want to be addressed. So that's it. If anybody has any questions, I'm happy to take them. Yes.
I'd like to go back to your legal documents for a minute.
Okay.
Power of attorney. We had ours made a year and a half ago because I knew I'd have difficulty writing. But what we didn't realize was that, at least in the state of South Carolina, it had to be filed with the courthouse. So we just simply went to the attorney, had it drawn up, we took it home. So last week we had to do a legal signing, and they didn't want to accept it because it had not been filed with the, I guess, the records of somebody in the courthouse. So I called my attorney and they said, oh yes, we'll be happy to file it for you. I don't know if that's required in North Carolina, but simply be aware that that may be an issue with a power of attorney.
That's a good point. Certainly make sure that you're following all the steps if you have an attorney or you have somebody that's helping you navigate those forms. Our social workers at the clinic are really more of an expert on this topic than I am, but they're a resource for you if you are filling those out and you have questions about the follow-through. It is different from state to state. I'm not sure what the requirements are in South Carolina versus North Carolina, but you're right. You don't want to sit down and think you're ahead of the curve and then find out that you haven't done things all the way through, so it's a good point.
Yeah. It's just for financial real estate. And that really wasn't a question, it was just a recent experience that we had and something that you might encounter if your spouse or you're not able to write and you have the general power of attorney, then it has to be filed, at least in South Carolina, it has to be filed with the courthouse.
That's great to know. Thank you for sharing that. Are there any other questions? And if you guys want access to the PowerPoint in a organized manner, you can give me a call or you can shoot me an email. I'll be happy to send it to you. The format,